Hello there and Happy New Year to you. Good evening and thank you for joining us on the first edition of NCDC Situation Room in 2019. Yes, it's the 7th day of January 2019 already. The year is moving very fast. Well, it's better to make hay while the sun shines. So, how are you coping with the dry season and the heat that comes with it? You know, talking about dry season and heat, are you aware that this is that time of the year when the country usually experiences outbreaks of cerebrospinal meningitis? Yes, it's that time of the year when you need to be very careful. As the dry season begins, it's expected that there would be an increase in the number of cerebrospinal meningitis cases in Nigeria. From the Nigeria Center for Disease Control Situation report, 8 new suspected cases were reported from Katsina State, and a total of 72 suspected cases reported from 10 states with 9 deaths recorded. However, the National Technical Working Group for Cerebrospinal Meningitis has been improving on the level of preparedness ahead of the 2018-2019 meningitis season. States in the meningitis belt have been placed on alert to ensure adequate response in case of a full-blown outbreak. My name is Abdul Fattah Otori, and today on the program we focus on cerebrospinal meningitis in the country and what the NCDC is doing to control it. Glad to know you're there with us. Now, as we have been telling you on this program, a lot of diseases spring out during the dry season, one of which is the cerebrospinal meningitis. Cerebrospinal meningitis, also called epidemic meningococcal meningitis, is a major public health problem still affecting tropical countries as Nigeria. It is highly contagious and mortality from the disease remains high despite major achievements in the treatment modalities. Meningitis is usually caused by a viral infection which could be bacterial or fungal. Symptoms include headache, fever, and stiff neck. It can spread through airborne respiratory droplets, that is, when an infected person coughs or sneezes. Those who inhale the droplets in the air can get infected if they do not protect themselves against it. You also need to know that all ages can be affected, although it rarely occurs in children who get vaccinated against it. Now, depending on the cause, meningitis may get better on its own or it can be life-threatening, requiring urgent antibiotic treatment. Well, at this juncture, let's get to hear from our drama group what message they have for us today. When we return, we go to the streets to find out what people know about cerebrospinal meningitis. I implore you to stay.
Stop it! Wait.
Yeah?
Do you want to kill me? Or you want to give me Lassa fever, Abi? Or is it yellow fever, sir?
Just imagine, able to tell me sorry, you can't tell me sorry.
Sorry, Bawo.
Chief Adisa, how can you say I have Lassa fever? Yeah? So I will have all these diseases and still be here with you?
Look,
yeah?
It is not written on anybody's forehead. See, the fact that you are sneezing alone is an indication that you have some irritations in your nostrils. That alone is a weapon of mass destruction, okay?
Weapon of mass destruction in my nose?
Yes.
How can you say a thing like that to me? Yeah? Come on, Chief Adisa, you don't like me at all.
Yeah. Whoa, my friend. Wobi, there is no sentiment when lives and property are threatened. What you are doing is a serious threat to me, okay? Heaven forbid I contract any disease through this your sneezing.
This me? Why are you talking like this? Me, I can't believe this.
Chief Adisa, Malam Usman, why are you wearing a long face this evening? Is there anything the matter?
Yes! Dr. Chuku, somebody, Allah, look, let me just ask you one question. Are you listening?
Yes, I'm listening.
Is it ever possible for someone to carry weapon of mass destruction inside his nostril? Just tell me now.
Chinekeme, weapons as in guns, bows and arrows?
Well, ask Chief Adisa, he's over there. Only him can explain that one.
Okay, Chief Adisa, please, tell us, what does carrying weapon of mass destruction inside one's nose mean?
Doctor, can you see that? Can you see that? Is that not weapon of mass destruction?
How is that?
I now know what Chief Adisa is saying. Chineke.
What is he saying?
You know, sneezing is a sudden involuntary expulsion of air from the nose and mouth due to irritations in the nostrils.
Okay.
The truth is that it carries bacteria, and that bacteria thrown into the air through sneezing can be contracted by someone else who inhales the air and could get infected.
You see what I mean? Usman, let me tell you, you cannot come and kill me in this village. Yeah?
Who will
Look,
kill you?
No. I am too knowledgeable for that. I'm an educated person.
Well, Chief Adisa, on the contrary, for the fact that Malam Usman sneezes does not mean he's sick or carrying any diseases. I must let you know that even ordinary pepper or any strong smell can cause someone to sneeze.
Yes.
No,
even dry okra if you are pounding it or perfume. Look, doctor, thank you very much for this thing. Or else this Yoruba man will continue to stigmatize somebody feeling like he's the only educated person among us.
Well, you see, Malam, Chief Adisa is right with his complaint, except he needs to do it with decorum. Whenever you feel like sneezing, quickly cover your nose with handkerchief or anything that can prevent the bacteria from going out into the air. But there is something more deadly I actually have come here to talk to you about.
What is that one?
Well, it is called Cerebrospinal Meningitis. It is also an airborne disease, but thrives more in a crowded area. You know, room without ventilation and all that. And now we are in its peak period because the environment is very dry.
Dr. Chuku, hey, you see, this your warning should go to Malam Usman here.
Which Malam
Yes,
Usman?
now. Doctor, he lives in a room and parlor with his numerous wives and children with only one window, which he doesn't even like to open because he doesn't want anyone to see his wives. And there are more than 7 in a room.
No, that could be dangerous, Malam. Listen, you must open your windows for fresh air to come in, especially during this period of heat.
Okay, I will do that. And for your correction, Chief Adisa, let me tell you, it's 6 people with 1 baby.
What of the children of the other wives?
Nobody.
They are up to 13, doctor.
Doctor, you know you are my friend.
Yes.
I've heard you and thank you very much for this advice. Do you understand?
Yes.
But what about you yourself, doctor? Yes, your brothers who sleep inside shop, Unko. Sometimes 6 of them inside one shop without fan. Yes, I don't know at the risk of this thing you are telling us.
Doctor, so in spite of this your education, your brothers too are like Malam here.
Hey.
Well, we are doing all we can to sensitize everybody. See, we all need to be careful this heat period. Observe good hygiene and stay away from crowded areas because cerebrospinal meningitis can kill within days.
Hey, doctor, come, how do I know when I have this disease?
It starts like fever. That is why it is very important that when you have fever, self-medication should be avoided completely. Go to the hospital whenever you feel unwell for medical tests and treatment. That's the best option.
Meningitis is kind of disease that comes out during heat.
I'm from Adama. People that are not from my side, that meningitis are new to them. Like my place, sometimes like during February, March, April, the temperature sometimes used to be 43, 42, 41, 44. So we are always proactive. Most of our houses, you will see standard windows, 3 or 4. And during that times, we don't close our windows, we don't close our doors. And we have mosquito net. We do open all the windows and the doors. We lie down to protect ourselves from meningitis.
What I would just advise people is that if you are still under 30 years or thereabouts, you can still go for immunization. But if you have past 30 years, even though you have even taken the immunization, just make sure you are in a very ventilated environment. Make sure you spend most of your time outside the house. If your house is not well rooming or well ventilated, make sure you always stay outside. You can enjoy the breeze. And at night, make sure you open all the windows and you have window net. But if your window did not have burglary proof, don't open it too.
The most important thing is to live in a well ventilated environment. If you are the type that has trees in your environment, don't cut it because it's a part of natural things that bring relief for the heat.
First of all, anybody that has meningitis, we do immediately. If you just discover it, we don't leave him at home. First of all, salt and sugar. This thing we put and give him to, and be drinking it before we even, that is first aid for him, before we take him to nearest clinic.
It's time to hear from you. Go ahead and speak with us. You can reach us through Twitter. The handle is at NCDCGov. Check us on Facebook. It's Nigeria CDC. You prefer to call? Then reach us through a toll-free line, meaning you don't get to pay when you call. The number is 0800 9700 0010. 0800 9700 0010. You can also reach us on WhatsApp. The number is 0708 711 0839. 0708 711 0839. We expect to hear from you. Thank you. All right, it's now time to speak with my guest. I have with me the Team Lead Technical Working Group for Cerebrospinal Meningitis, Dr. Olaolu Aderiola. Thank you so much for joining us on today's edition of the program, sir.
Thank you so much, sir.
Now, Dr. Aderiola,
Yes.
one wonders at this time of the year, the nation usually records human losses as a result of meningitis. And towards the end of last year, going into this new year, we've seen some cases already. Why is this so?
Thank you so much. Meningitis occurs, cerebrospinal meningitis occurs throughout the year, but during some specific period of the year, the harmattan period, the factors make it easier for meningitis to spread much more, which could now reach an epidemic level. That is, the number of cases are now beyond what is expected. So it could cause a lot of damage in terms of deaths, people dying, and also could make people have complications as a result of having meningitis.
Now, when you say factors, what exactly are you talking about here?
We are looking at the atmospheric factors. There is no more rain, so the atmosphere is dry. The water content in the air is very low, so we say that the humidity is low. Then you also observe that the speed of wind is higher and is very dusty. So you have wind coming in from the northern parts of the country, the harmattan wind blowing across the country. So it's more intense at the northern part of the country.
Why is that?
Because meningitis is an airborne disease. So once the atmosphere is dry, once there is no rain, once the temperature is high, it makes it easier for people to contract meningitis from one person to the other.
Hold on a second, doctor. Are you saying that wind is a carrier of this infection?
It's airborne, so the wind can carry it.
So apart from weather and the atmospheric condition you have mentioned, which other factors can cause cerebrospinal meningitis?
Okay. Most people, when even they have the organism in their throat, it's not everybody that will come down with the disease, because innately we have ability to resist infection coming into our body. So God has given us that defense mechanism. But when our throat now becomes dry, which is also because of the dry atmosphere, it gives opportunity for the organisms to be able to pass through our protective membrane, which now makes it easier for the meningitis organism to pass into the bloodstream and eventually get into the cerebrospinal fluid, which is a sanctuary part in the body that is sterile. That is, it shouldn't have any organism whatsoever in the cerebrospinal fluid.
Okay, today we're narrowing it down to cerebrospinal meningitis, but I'm just wondering, are there other types of meningitis you want to tell us about?
Meningitis essentially is, what it means is that there's an inflammation, that is swelling of the lining covering the brain and the spinal cord. So anything that enters into it can make the lining to swell. Chemicals can cause it, bacteria can cause it, fungi can cause it, viruses can also cause it. But during this period when we have the harmattan, the one that usually causes the epidemic is the bacterial meningitis.
So how can this be prevented from snowballing? As it is, we already have cases in about 10 states.
Okay, the prevention essentially ensure that you eat well, eat balanced diet. That is basic for anybody to prevent diseases. Ensure you are eating well. Ensure you avoid overcrowding. That is very important. And sleeping in a well-aerated environment. Ensure that when you cough, you cover your mouth or nose with a tissue, or you cough into your elbow. And also ensure that you wash your hands regularly with soap and water. Those are the things that help to prevent people from having meningitis.
Now, in a case as we have in many communities around us, where you find more than 6-7 people in a room meant for 2, what do you do?
Well, I guess that's a situation in which some of us may have found ourselves in the country. Essentially, a room shouldn't be overcrowded. You shouldn't have more than 2-3 at most in a room. But when you now have more people, that means all of you are using the same air which 1 or 2 persons would have used, and there will be enough exchange. As we said, meningitis is an airborne disease. So in breathing in, breathing out, coughing, you will force the bacteria out, and anybody that is close by can now inhale it, and that person could now have the meningitis.
Okay, now, doctor, for instance, I find myself in a crowded place. How do I know I am infected with cerebrospinal meningitis? What are the signs?
Yes. So for a person to know that he has meningitis, the first symptom that comes with will be fever, which means that an organism has entered the body and the body is giving an alarm that something is wrong. That means the body will become hot. Some did now progress to having headache, progress to neck stiffness. That's one key aspect of meningitis. Some could now be vomiting. Some could have what we call sensitivity to light, when they find it difficult just walking outside normally. If you go out under the sun and you don't feel any discomfort, but you now started feeling some discomfort, that means there is something wrong. So those are the signs that could come up. Vomiting, nausea, those are the other symptoms that come up.
Now, you talked about fever generally, but self-medication is very common around here. Once people have fever, they most times engage in self-medication.
Self-medication is not advised at all, because the way God created our bodies is to give us some indicators. It's just like we have pain sensors in the body. If you are walking and you step on a needle, it's because of that pain that will make you to move your feet so that you don't injure yourself. So the first indicator that something is wrong in the body is that increase in temperature, which we call fever. So that gives the first sign that something is wrong, and it's good that people go to a health facility to see a health practitioner to know what is the reason for that increase in temperature. And as we know, it's not just meningitis that presents with fever. Several other diseases present with fever when something is wrong in the body. So that's the first sign. Then the clinician will now ask more questions, looking for risk factors, where you have stayed, the condition of your house. So those are the things that will give inkling that something is wrong, coupled with other symptoms aside from the fever that the patient may have.
Okay, now, how do you treat meningitis when it occurs?
Yes, and that's a good thing with meningitis, bacterial meningitis. There are antibiotics which is able to kill the organisms completely. And once treatment is taken quickly, the person recovers very well. So that's a good thing about bacterial meningitis. Antibiotics is very effective to cure.
That's if treated immediately, right?
Almost immediately.
So what happens if delayed? What's the consequence?
If it's delayed, the consequence is that there will be some complications. There could be some hearing loss. It could affect the brain. The person may not be able to reach the normal cognitive aspects. That is, things that a person would have been able to do well, you can't do it that well again.
Such as?
Okay, so like if you have it in children now, they may not be as intelligent as they would have been if they didn't have meningitis. So that could now affect the educational performance of that child.
So what can be done in that circumstance?
Once the signs and symptoms arise, go to the health facility. They'll check you. They'll do the necessary test that is supposed to be done. If the test confirms that it's meningitis, the person is treated and the complications will be very minimal or no complications at all if treatment is sought quickly.
All right. Now, you said this has to be done very quickly. Tell us, what's the danger period for which treatment may be too late?
Well, the thing with meningitis is that it's a very fast disease and can kill within 24 hours. It kills within 24 hours. So once the symptoms come, you go to the health facility so that the necessary test can be done, which we call a lumbar puncture, which means that a needle will be stuck at the lower part of the back to take some of the fluid. As you said, it's cerebrospinal meningitis. So which means there is a bacteria in the cerebrospinal fluid. So once that sample is taken, we'll be able to confirm in the laboratory whether it's meningitis or not. But we don't wait for the result to come. Once we take the sample and the signs are there, we start treatment immediately. We now wait for the result to confirm whether it was meningitis or not. But as I said, because it's very deadly, treatment has to be started quickly. So we don't wait for the laboratory result. We collect the sample, start the treatment, then wait for the result to now see whether it's meningitis or not.
Okay, now we know how deadly meningitis is. So is it gender or age influenced?
Thank you so much for that. So meningitis can affect every person. Whether you are old, you are young, you are a male, you are a female. It affects all classes. It affects everyone. But looking at the distribution, we have observed that it affects more males than females, and more of persons below 15 years than the other group. And probably there are some reasons which could be adduced to that. For the male gender, as I said earlier, when the amount of fluid in the body is low and there is dryness, it could give opportunity for the organism to now pass through the linings to now cause problems. And as you know, smoking is one thing that most of our youths take part in. So for somebody who smokes, the risk of that person having meningitis is higher than somebody who doesn't smoke. So that's one thing that could make the males to have more meningitis than females. Find that most males smoke than females.
All right, as we end this discussion now with 9 deaths between last year and now, what's the Center for Disease Control doing to ensure that it is adequately controlled?
Okay, thank you so much. At NCDC, we know when the meningitis outbreak will start, and before that time, we've made preparations with state ministries of health and also our development partners. Before this time, we've done a risk assessment to know which states would most likely have it before others. We have sent letters to the Honorable Commissioners in 25 states and the FCT. Those are the states that have higher risk of having the outbreak, so that they prepare for this. And the preparation includes training health workers about the signs and symptoms, ensuring that they are proficient in collecting the cerebrospinal fluid samples from patients, ensuring that there are enough drugs, antibiotics available for treatment when they come to the health facility. So these are some of the things we have done. And also, we also engage with the media to help us let people know the signs and symptoms of this and what they need to do to prevent this. Furthermore, at NCDC, we train health workers at the state level on how to diagnose and how to be able to determine who has meningitis or not. So this cuts across the clinicians and also the laboratorians who will conduct the test in the laboratories. Other thing that we've done is that we support states in medical consumables they need for treatment, because we know we all need to come together to fight meningitis. So though it resides in states, we coordinate the response of the state so that each state knows what is happening to the other state, so that we can reduce the number of cases and drastically reduce the number of deaths due to meningitis.
I must say a very big thank you to you, Dr. Olaoluwa Deriola, Team Lead, Technical Working Group for Cerebrospinal Meningitis for Nigeria Center for Disease Control. Thank you very much, sir, for coming on the program.
Thank you. The pleasure is mine.
All right, it's now time to join Godwin Odemije in the Situation Room. Godwin, what's new?
Thank you, Abdul. Now, looking at the 5 thematic areas NCDC is currently focusing on, Lassa fever is still hitting hard, spreading to more states of the Federation. I have on the line Mrs. Ese Ilori, the team lead, National Technical Working Group for Lassa fever. Thank you very much, madam, for joining us. Happy New Year.
Thank you. Happy New Year.
Now, Mrs. Ilori, let us talk about Lassa fever. What is the update?
Yeah, the situation right now, I'll give you the data as at last year, because for this year we're still trying to collate the data. But the situation right now is that we're having cases coming up, and well, this is expected because it is the season. As at 31st of December, we have 363 confirmed cases with 171 deaths. And we have 9 states that are actually active, that are reporting the cases as at that week.
So tell us, which states are involved?
Yes, right now we have 9 states, and that's Edo, Ondo, Plateau, Gombe, Bauchi, Nasarawa, Adamawa, the FCT, and Delta State. Those are the states that are currently reporting confirmed cases.
But do we still have health workers involved in the cases?
No, we do not have health workers now. We've not recorded health workers for some time now. So at least that's a good sign that the health workers are a little more careful.
So what is NCDC doing now to contain the spread and manage existing cases?
Now, what we did towards the end of last year, the DG and then the team lead for Lassa fever technical working group, went to the 2 treatment centers, that's FMC and the ISTH in Airborne, to encourage them, because they have been so hardworking, they have done a lot. So the DG felt that he should go there and encourage them and also sensitize them to expect cases and try to find out how prepared they are. Right now, we have a team that has gone to Bauchi State, because what we do at the NCDC is that we look at the situation, the data that is being sent. We assess the situation in a state. We do not wait for a state to say we have issues. We assess the situations in states and then we go to the states ourselves. So now we have assessed Bauchi State and we have found out some gaps in Bauchi State. So our team are already in Bauchi State right now. The other thing we're going to do is we are sending our rapid response team to the 3 hotspots, and those 3 hotspots are the Edo, Ondo, and Airborne, to stay with the states, prepare properly with the states, support the states in all the response activities, and make sure that we're able to respond in time, and also sensitize the people to be very sensitive, to have that index of suspicion if there's any suspected case.
So, as a way of rounding off, Madam, what will you advise the people to do in terms of protecting themselves?
People should try as much as possible to prevent the rodents from getting into their houses. This is the season for bush burning. So we are saying now that people should, as much as possible, avoid bush burning. Then protect your food items. Put them in well-covered containers where the rodents will not have access to. Like your pot of soup, cover it properly. Don't leave it half open, saying that you want it to cool before you cover it. Wash your hands regularly. That is, in fact, that's one of the best ways of preventing diseases. Wash your hands.
Madam, we must thank you for speaking with us on the program today.
You're welcome, and thank you too for all your work and for your support. We really appreciate you. Thank you.
Now, over to you, Abdul, for the rest of the program.
Thank you very much, Godwin Odemije. And of course, with that, we'll wrap up today's edition of NCDC Situation Room, the first in the year 2019. We thank you for being a part of the program. If you want more explanation on what you've heard today, or you just want to know about the Nigeria Center for Disease Control, please reach us via Twitter. The handle is at NCDC.gov. We're also on Facebook. You can find us using Nigeria CDC. Call us on a toll-free line, meaning you don't pay when you call. The number is 0800 9700 0010. 0800 9700 0010. We're also on WhatsApp. The number is 0708 711 0839. 0708 711 0839. Thank you very much.